Hi, you guys. Thank you so much for tuning in. For those of you who don't know me, I am SBell, and I'm founder and owner of SBell Wellness. And I really just love to come and pour into people and share about natural solutions and just routines that we can use to really help ourselves with well care at home. So tonight I'm going to talk about essential oils and natural solutions for pain, discomfort, and really just some things that we can do to support ourselves and feel empowered for that at home. So first, I encourage you to kind of think about, like, if you're dealing with pain or you do deal with pain, there are 3 different types of pain. And so we can think of pain as chronic pain, emotional pain, and then occasional pain. And so maybe just think about, like, rating yourself when you think about those types of pain that you might deal with. So chronic pain just really means that it's kind of a daily part of your life. So it's something that you are dealing with on a regular basis. And maybe just think about rating yourself from 1 to 10, where you fall in that pain scale for chronic pain. And then we'll think about emotional pain. And so, you know, the heaviness of emotional pain is real. And oftentimes that emotional pain can kind of exacerbate and start to show physically. And so we want to think about this heaviness of emotional pain. Where does that fall on the scale of 1 to 10? And then we'll think about occasional pain. And so that's the pain where we've got good days and we've got bad days, but the pain is there. And if we think about it, we do know that we experience it on a regular basis, off and on. And so think about that from 1 to 10. And that just helps you kind of get a picture of where your body is in dealing with pain. And then we can think of the systems of our body. So where in our body are we feeling that pain? And so that just kind of really helps us. And where I want to start when I'm talking about this is really talking about foundational support. And so for me personally, I dealt with pain, a lot of joint pain, just muscle aches, joint pain. I dealt with migraines since I was 5 years old. And so there was a lot of pain that maybe was unexplained and couldn't really figure out the why until I started looking at the foundation of some things. So really looking at nutrition and just really getting to the root of that foundationally really changed a lot of things for me personally. And so that's why I really like to think about it from that nutrition standpoint first, and then what other things we can add on to that to support. And so just thinking about, like, eating right, and that really means very different things for every person, but something that we can really focus on in a general standpoint is just making sure that we are really avoiding those high processed foods, high sugar foods. Those are foods that really cause inflammation in the body, and a lot of pain is related to an inflammatory response, especially over time. So really wanting to think about weeding those things out. And then you can also dig in and really start to learn about food allergies, food intolerance, food sensitivities. That was a big thing for me in working with a naturopathic doctor, finding out food intolerances. Because what happens with food intolerance is that your body is actually creating metabolites, which means that's inflammation going into the bloodstream, and really starts to wreak havoc. And so that's a lot of where, my gastrointestinal issues, my thyroid issues, everything was actually pointing to that inflammation happening. So inflammation was at the root, and then disease started happening because of that. So we want to think about those things. We want to think about exercise and whatever that means for you too. So movement is just important, getting our body moving. And so it really depends on what feels right for you. It might be a walk, it might be an intense workout, and it might be a combination of those things in between. It really is what fuels your body and what helps you feel good, but just really making sure that we're in a routine of movement. And then rest and managing our stress is incredibly important for that foundation. So I'll talk about some things for that. Reducing our toxic load is incredibly important for inflammation. And so I have a whole class on that, just really talking about how swapping out a lot of our products that we use for cleaning, for personal care, can really help to eliminate a lot of those toxins. That was huge in my well care plan, and really I found a lot of success in being able to swap out those things. And so over time, that toxic load, I mean, we have our wonderful organs that are meant to filter that out, but over time they're being overworked, and that just leads to disease as well. So tapping into reducing toxic load. And then I briefly mentioned a little bit about, naturopathic care. It doesn't mean you have to have a naturopath to really kind of go on this journey, but I do encourage you to have a partner in your medical care that you can have this dialogue with and you can feel comfortable with it. And so it can be incredibly intimidating to try to go this integrated approach if you don't have a physician on board who is willing to listen and allow you to have a voice in that. So I always encourage that, proactive, informed care is really important. So I can't encourage you enough to make sure that you are finding someone who can partner with you, and that you can feel like you can approach and kind of discuss these things. And I can't promise they're always going to have those answers as far as how to use natural supports, but what really matters is that you can find resources for that, but that they will listen and allow you to have some choice with that. And so one of the biggest things when we talk about foundation of health is really looking at supplementation and a quality supplementation. And so one of the products that doTERRA has that's been super instrumental in my health is Lifelong Vitality. And so Lifelong Vitality is a series of supplements that can really support us. And so it's got a Microplex VMZ in there, which is a multivitamin. And I know that people have taken vitamins before and have said to me, like, I just don't know that they work. And that was totally me. And when I started working with doTERRA, I had lots of friends who were telling me how they were really benefiting from them. And so I really dug in and really saw that there is a difference in vitamins out there. And so doTERRA's vitamins are a whole food complex. And so what that means is that your body's going to be able to really process those nutrients, know what to do with it, and really support you. And so that's really the difference in quality really matters if we're going to get what we need from it. And some people ask, like, do I need vitamins if I'm eating really well? And the answer to that is yes, because unfortunately the soil is so depleted of our nutrients. And when we cook our food, it actually decreases, enzymes in it and that sort of thing that really impacts our body's ability to absorb the vitamins that we need. Vitamins are crucial for being able to help us manage pain. The next one in that series is the ZE Omega. So those are the omegas. They are plant and marine based. And so having both of those together allows the body to process and absorb much better. One of the biggest things when we talk about pain that omegas really come into play is that oftentimes when our body is trying to get rid of inflammation, it actually goes into the bloodstream and has a hard time filtering out. And so the omegas are just like a really nice flush to help that. And so that's really important to have those omegas when we are trying to decrease or have a healthy inflammatory response. And then the third one is an alpha CRS, which is a cellular level complex. And again, we want to have our cells replicating and doing their thing in a very healthy way versus an unhealthy way where we might see some growths and disease happening. So we want to make sure that we have that cellular vitality complex to help us. And so lifelong vitality, when we talk about pain, how's it going to help chronic pain? It helps chronic pain by providing that healthy response to oxidative stress. So what's oxidative stress? Really, we get it from diets that are high in sugar, processed food, alcohol, some medications, pollutions, pesticides, chemicals. All these things are happening in our body. Our body is designed in such a way to try to help us reduce that oxidative stress. However, our organs are being overtaxed. and we're not able to do that. So these vitamins and minerals are really going to help our body be able to have a healthy response to that oxidative stress. It's also going to support our bone health. So calcium, magnesium, zinc, vitamin D, those are all incredibly important for our bone health. We want our bone health to be strong and supportive so that we aren't dealing with pain due to some weakness there. And then also it's supporting our healthy joint function and comfort. And so again, inflammation plays a big factor in joint health. And so if we can keep this healthy inflammatory response with our vitamins, we are supporting chronic pain in that way. We're going to support emotional pain through these vitamins really help us with mental clarity, brain function. I know for me, I dealt with brain fog, an incredible amount of brain fog actually, until I was taking the full dose of the Lifelong Vitality. I really started to notice a difference in not having that brain fog show up for me. So that's really important, because brain fog, you guys, it really does lead to some emotional, kind of getting stuck with emotional stress is just the best way to put that. Again, these omegas in here are really going to help support our gut health. And so gut health is so linked to our cognitive health, you know, our immune system, all of these things that when they get weakened, we deal with pain. Pain is something that shows up as a response to these things happening. And so these omegas are really going to help support that gut and brain health. And then they also provide this protection against lipid oxidation. And so that's oxidation that happens when these toxins are deposited into the fat in our body and it's stored there. And there's a link with that for depressed feelings, anxious feelings. And so when we're talking emotional pain, we want to really look at tapping into making sure that we are not having this lipid oxidation. We don't want these toxins being stored in our body. And then also just, you know, healthy brain and eyes and nervous system. That's so critical for all of our senses to be working well for our emotional health. And then occasional pain. So these Lifelong Vitality, they're going to provide that foundational support. I've already talked about, you know, the vitamins and minerals in there. They're just really going to help us stay at that peak performance. We talk about, you know, movement, and we want our body to be able to do these things that we know are good for us. But we also don't want to have to kind of push through pain in order to do them. And so this is a way to kind of help us with that. And then the optimal nutrition support that we're getting from it is really helping our body speed up that recovery process when we are dealing with pain, whether it's from, you know, surgical things that we might have to recover from and that sort of thing. And so, or some sort of injury that we might have had happen to us. These vitamins are really going to help our body be able to speed up that recovery process and help us manage our pain. Before I get into a couple of other natural solutions, I just want to say how important it is to really think about this from the perspective of the dangers of prescription pain medication. And I tread lightly here because I respect the fact that sometimes that is necessary. However, they are so overly prescribed that it is incredibly dangerous. And it's really scary. It's really wreaking havoc on people's lives. And I think it's really important as a natural provider to just bring attention to this and just talk about it. Prescription pain medication actually causes more death than car accidents. You know, they start to become like this seen as safe and that sort of thing in society. And so they start to be something that people are taking at even a young age, and it's just becoming something that can cause a lot of addiction and start to lead to a lot of emotional and physical things that maybe could be avoided if we're looking at other options. They do give this false sense of euphoria. It's really this temporary fix. And so it really is just letting a signal to our brain tell us that we're not in pain. It's not actually getting to the root or the foundation like I was talking about, and really helping us manage through that and recover from that. And so that's, you know, where the addiction piece comes in, because we need more and more and more of that in order to continue to get that signal that we're not in pain. And so how much more empowering is it to actually get to the root of the pain and be able to manage that way? Withdrawal symptoms, you know, there are people who are dealing with that and having to try to get away from that after even taking it for just a small amount of time. You know, those symptoms can be anything like insomnia, leg spasms, vomiting, diarrhea, cold spasms. Oh my gosh, withdrawal is just not a good thing that we want to have to experience. And so, you know, it is estimated that 90% of people with chronic pain are actually prescribed opioids. And again, they were designed for short-term solutions. And unfortunately, they're being used long-term. And so that's just wreaking havoc on the body. And so it's so important for us to really think about other ways to address that. Because over time, opioids actually do cause digestive shutdown. And so that's just causing so much havoc on our body, not only discomfort, but, you know, so much of our emotional well-being is rooted in our gut. And so it's just really snowballing in effect if we are really trying to use prescription pain medication to manage. And so, of course, it's not my place to talk about kind of weaning off of something like that. That is something that I would recommend you work with a physician and let them know if that's something that you're dealing with and you wanted to be able to do that. You know, there's some great solutions to do that. I've already talked about the lifelong vitality and how that can support at that foundation. And I want to talk about some oils that can do that. And so there are, you know, a lot of different oils that we can tap into that natural chemical composition for pain. Two top ones are Deep Blue. So Deep Blue is our soothing blend, and you can use this topically. You can also diffuse it too, but it's used topically mostly. You can dilute it and put it on wherever that localized pain is that you're dealing with. Also comes in a rub, which is like nature's icy hot. It's going to give you that warming and cooling effect and really help to support the body with pain. One of my favorite blends to make with Deep Blue is actually Deep Blue, lemongrass, and frankincense. So I have a personal story about pain in this. Right after I started working with doTERRA, I had surgery to have some endometriomas removed. And I was at a place where I had done a lot of detoxing from, you know, chemicals for cleaners and personal care and that sort of thing. And so I really didn't want to go on pain medication, even for a short period of time. And so tapped into natural solutions, and I used this roller blend of Deep Blue, lemongrass, and frankincense completely successfully after my surgery without taking any sort of pain medication, prescription or over the counter. And so for me, that was totally empowering. It was just something that I was really wanting to have in my life. And so I just did it very routinely. Anytime that I felt like I needed it, I was putting it on topically. And really just supporting my body in that way. And so I can't say enough about that. That was several years ago now, and I continue to just grab this roller for any sort of pain that I'm dealing with. Past tense is also a really awesome one. If your pain is related to tension, this tension blend, it has a mixture of a lot of mints in there. So you've got wintergreen and peppermint. There's lavender in here, marjoram, Roman chamomile, and rosemary. This blend only comes in this roller. This is actually not diluted. So you could actually cut this in half and dilute it yourself and stretch it out a little bit longer. But if you deal with a lot of tension and you want that direct support and you feel comfortable with putting that on topically without diluting it, you certainly can. Just be mindful of your own skin. I will say marjoram is in this blend. It's also in Aroma Touch, which is our massage blend, which is another one that can be very helpful for pain. But marjoram alone has been one of my new favorites. I actually have been taking it internally. I deal with hormonal head tension, and it's something that when stress is heightened, I see that happen more frequently. And so I've actually been taking this marjoram internally in a veggie capsule. It's just a vegetable glycerin capsule that I take on a regular basis to really help support in a proactive way. And so I definitely recommend tapping into marjoram if that is something that you deal with as well. It's a really awesome pain support. And then the other one, of course, is copaiba. So copaiba is just such an amazing oil. It can really tap into a lot of our systems in our body. It's working synergistically with our endocannabinoid system. It comes from the copaiba plant and not the cannabis plant, so there's no risk of having, THC or anything like that, but it is going to work synergistically with our endocannabinoid system, which is incredibly important for that healthy inflammatory response I talked about. And so no matter which system your body is struggling with pain, copaiba is going to be one that you can use topically. You can take it internally, and then you can also use it and diffuse it. And so you can use it all three ways to really support you when it comes to pain. So those are the oils that I wanted to share. Those are the top ones, but I do encourage you to actually, grab your Essential Life book. If you're dealing with specific pain, you can look up specific systems of the body and really tap into it. In the same way that medication, you might have to try different medications to help support you. Plant therapy is similar in the sense that our body responds in different ways to different plants, and so you kind of have to get to know your body. Like I was saying, with recently noticing that marjoram is something that my body is really responding to for hormonal head tension. And so it's just getting to know which ones can help support your body. So just listening to those messages and just knowing that, if you are dealing with pain, it's really looking at the foundation of things, digging in with nutrition and seeing if that's something that is really playing a factor as far as your healthy inflammatory response goes, really tapping into supplementation to support that nutrition, and then looking at some things we can use in place of over-the-counter and prescription medication to really help our body be able to get to the root and kind of recover from that in a safe and effective way without having to deal with long-term repercussions of some of those things. So I hope this was helpful information. If you have any questions and you weren't here live, please feel free to drop me a message. You can just jump over to sbellwellness.com. All my contact information is there. I'm happy to help support you in whatever individual needs that you have as far as well care goes at home. And then also, I talked about how to find a physician that can help kind of be on board and be a partner with you if those are things that you are wanting to kind of move past and be able to take some more of that empowerment for your wellness into your own hands. So I can help you with some, guided questions and those kind of things as far as finding someone to be a partner with you. So don't hesitate to reach out, and I hope to see you at a class sometime soon. Take care and be well.